right now, there's a growing number of voices opposing the vaccination of children against COVID-19. More than 200,000 South African children between the ages of 12 and 17 have been vaccinated with a single dose of the Pfizer vaccine since September. To talk more about this, we're joined by the director of the WITS Vaccines and Infectious Diseases Analytical Research Unit, Professor Shabir Madhi. Prof, thank you very much for your time. Now, I'm sure you've heard about political party, the SEDP, as well as other organizations taking the National Health Department to court for vaccinating children between 12 and 17. Do they have a leg to stand on?
Good morning. And the short answer is absolutely not. In fact, if I'm not mistaken, ACDP tried doing very much the same thing when we introduced the HPV vaccine for girls in schools. And there was also resistance in terms of the introduction of a vaccine for girls, which essentially would protect them against developing cervical cancer later in life. In this particular instance, there isn't any constitutional reason why children should not be vaccinated. Children should be vaccinated against COVID-19. For me, the bigger issue is the timing of when we start vaccinating children and get the most out of the vaccines that we currently got available. So it might be that children aren't a priority right now, but certainly the principle of children needing to be vaccinated against COVID-19 very much stands, and it's something that is recommended globally, but it's really the timing of when that occurs which should be up for discussion.
Now, we did also read an article from a scientist saying that it's unnecessary to vaccinate children between the ages of 12 and 17 because their immune systems are slightly stronger. It would be better if South Africa saves the Pfizer vaccine to continue to drive those 50 and above.
Well, there's two parts to that. So certainly a single dose of the Pfizer vaccine in children 12 to 17 years of age is unlikely to accomplish much. The main reason you're vaccinating children between 12 and 17 years is to protect them against infection and reduce the ability of them transmitting the virus. A single dose of the Pfizer vaccine unfortunately doesn't perform too well, especially against the Delta variant when it comes to protecting against infection or transmitting the virus. So if you're wanting to vaccinate children, you should be giving them the full schedule of 2 doses. That being said, the focus in South Africa is about using vaccines efficiently so we can minimize the number of hospitalizations and deaths which transpire when we experience another resurgence. And the way to do that is to ensure that 50%, at least 90% of people above the age of 50 are vaccinated. And although we are struggling to get to that sort of a threshold, what we can do and get more out of these vaccines that are now being used in children is to actually provide a boosted dose of vaccine to any individual that's above the age of 50 or has an underlying medical condition that's received only a single dose of the J&J vaccine, and even high-risk individuals that have already received 2 doses of the Pfizer vaccine, they would benefit with the 3rd dose of the Pfizer vaccine. So it's about how we get the greatest efficiency with the vaccines that we've got available, rather than just chasing behind numbers of the number of vaccines that we've used or the number of people that are vaccinated. What's really important is who is being vaccinated, which will determine just how useful these vaccines will be to weather the next resurgence, which is likely to transpire in the course of the next few months.
And how's this drive working for us, Prof, in terms of the 12 to 17-year-olds, and why the 1 dose? If the child, for instance, has underlying conditions, do they not need 2?
Absolutely. Like I said, a single dose in a 12 to 17-year age group serves very little value. Because children, otherwise healthy children in a 12 to 17-year age group are simply not at high risk, or they're at a nominal risk of being hospitalized for COVID. But they can become infected. But if you're wanting to protect them from being infected, then you need to give the full 2 doses. So a single dose, the reason the Department of Health gave for using a single dose is because there's a higher frequency of a side effect, which is mild inflammation of the heart, especially in boys, after the 2nd dose of the Pfizer vaccine. But that really doesn't form a scientific basis for using a single dose, which is not going to confer much protection when it comes to protecting against infection and mild COVID. So if children do have underlying medical conditions, they absolutely should be receiving 2 doses of the Pfizer vaccine. And the use of a single dose of the Pfizer vaccine in that age group, those doses would be better utilized in boosting adults above the age of 50 that have already received a single dose of the J&J vaccine, as well as healthcare workers that have received a single dose of the J&J vaccine, and others above the age of 50 that receive 2 doses of the Pfizer vaccine. Those vaccines that are probably being wasted in children 12 to 17 could be better utilized to optimize the protection in those high-risk individuals.
And while I have you very quickly, Prof, maybe going back to this lawsuit, to this case that's going to court with the ACDP and other organizations, maybe the only leg they might have to stand on is the consent part of this drive.
Children are, in terms of South African law, children are able to make decisions that affect their health. So I think that is also the case when it comes to HPV vaccine. And even as is the case, as an example, when children go to a clinic for contraception, as an example, they are allowed to access contraception at clinics. So I don't believe that there's a case in terms of law for children not to be able to make decisions, especially if they're in the age group above the age of 12. Where otherwise you would also always need to assent them in terms of getting the individual consent. Even if the parents gave consent in terms of medical procedures, you are still meant to get consent from the children for medical procedures to be undertaken.
All right. Thank you very much for your time. Wits University's Professor Shabir Madhi, of course, they're telling us that the ACDP and those organizations taking government to court for the vaccination of the 12 to 17-year-olds actually don't have a leg to stand on.